Okay, did y'all hear that? The question: how do I get my sex life back? Chronic pain is taken away. We're going to address that in the two seminars and the discussion groups in this series, Triumph Over Pain. But since it's been opened up, let's kind of go over it a little bit and for the as an introduction. Chronic pain causes lots of problems with sex and intimacy because it causes problems with relationships. Relationships, you have to have good relationship and good communication to get sex and intimacy. For me, when I had chronic pain, my right arm and my back were a problem, so I couldn't support myself, and I had problems laying straight on my back, and so I had a lot of positional and physical limitations. And the meds, well, they turned me off. The meds caused fatigue problems. The meds were a big problem. I was always fatigued. When I was a pain doc, I got lots of complaints about it, and we dealt with it as best as we could. Um, I wish I'd had a program on it, but remember, you can talk to your healthcare provider, your pharmacist, your herbalist, and people you trust, people in your support group. If you don't know or you don't feel comfortable, ask some questions. How familiar are you with treating sexual dysfunction? Could you refer me to somebody? What do you see as options as treatment? Things like that, okay? Um, Chronic pain influences every aspect of your life. You may not see yourself as sexy, romantic, desirable, but you can't let chronic pain define you. That's what we're discussing today. You've got to define your own life. Pain will drain you. It'll take your spoons away. It'll make you fatigued. The medicines will cause dry mouth, flushing, decreased blood pressure, which can cause you to feel dizzy. You can have fatigue. You can have problems with orgasm, problems with libido. In fact, narcotics decrease testosterone over time, and that's what inhibits libido in a lot of people, both female and men. Uh, your your disease process can cause nerve problems, circulation problems. Your pain can cause problems in positions, but all those things can be dealt with. Every single one of them. Medications can be changed. We can use herbs and medicines to enhance. We can teach you positions. We can deal with circulation and nerve problems. These things can be examined. These things can be addressed. What you need to do first, though, is examine your emotions and your fears, because that's what really gets in the way most of the time. Couples can have a hard time. They lose self-esteem. You're in the middle of suffering. You've lost the old self. You need to open up, talk to your significant other. You may need counseling. Chronic pain can drive your relationship into a very unequal situation. It can change it. You may need to rebalance it. One person suddenly is the nurturer and the caregiver. That needs to be addressed. You can keep your meds from interfering with your sex life. We can change those. We can add meds to increase desire, to help with sexual dysfunction. Herbs can be used like ginseng for endurance, horny goatweed for sexual enhancement, aphrodisiacs. We can go to the big guns in the men, Viagra and Cialis. There's lots of things we can do. But most important is overcoming the fear and anxiety of engaging in intimacy. Open up the communication, discuss it, plan, have some laughter, release, let go the fear. Yeah, there's postures and positions that'll help. There's all kinds of websites on that. But what they don't teach you in that is it takes patience and time and open communication. You need to be able to discuss what is pleasurable, what position works. You need to build up your self-esteem. You need to get your groove back on, I guess that's what they say. Get your sexy back. It's not always in bed either. Massage, bubble baths, whirlpools. Pools are great. Pools lift you up. They decompress. They give you a lift. I'm not going to go into that in detail right now, but there's masturbation. There's mutual masturbation techniques. There's alternatives to intercourse if that's painful. You must, though, have a comfort with your partner. Comfort, confidence, companionship, and communication. Comfort, confidence, compassion, and communication. Okay? We can teach you relaxation techniques. We can teach you biofeedback. Your support group can give you more support. All these things reduce those fears. The most important thing is getting together, talking. You'll be creative once you open up. You'll be able to help each other, but you got to first reach out. And sex is great for pain. Sex decreases pain, increases endorphins when it's done correctly. Um, and when you give pleasure to someone, it increases endorphins. What? Well, that's funny. Someone's using my own statement against me now. Do the work, it will pay off. Okay, all right. For all the people that are listening on the podcast, the Triumph Over Pain series, which will be on the website if you subscribe to, or you are in our new, or you sign up, um, that will be, there's two things on the practical sex issues, and also on our coaching side in the future, which will be up in a couple weeks to a month, Dr. Kent's site. Um, we also discuss it in detail, and we have small discussion groups available, as well as individual counseling. All right, everybody go to lunch.